Do you ever use these words? Well, the way we do things here is this. I'm going to encourage you to stop saying that. I've heard people say that because they're trying to help people understand. The biggest challenge in chiropractic is people trying to buy a product that you don't want to sell. Right? They want to buy one adjustment. They want to buy a quick crack in the mid-back, but don't touch my neck. They want to buy 4 adjustments or some physical therapy. They want to buy a shoulder rub. Whatever the case is, doesn't matter. If you don't sell those things, it becomes awfully confusing right away. And when you do things like an initial exam and then have them come back for the results so you don't adjust on the first visit, if you use verbiage like the way we do things here is, what that automatically means to that person is elsewhere they do it exactly the way you're looking for. That's true. And it's absolutely exclusionary. I was at a spa this weekend, which is voted the best spa in the world. It's in the mountains in Vernon, BC. And when I spoke to somebody, she was obviously the most untrained person at that resort. And I was trying to get a towel. I was just trying to get a towel. I had, a towel from earlier on and it was wet, and I was going into the steam room and stuff. I wanted to switch out the towels. And she said to me, she says, well, we don't have any more yellow towels. I said, well, I'll take any color towel. I just want a dry one. And then she said the words, well, the way we do things here is, and then she described how yellow towels means that the person has paid for the spa. So somebody walking by, seeing a person with a yellow towel, knows that that person has paid for the spa and is staying in the hotel. And the person with the white towel means something else. But to me, in that moment, that didn't mean anything. All that meant was you are not finding a solution that helps me. If she had just been matter-of-fact saying, we're out of yellow, I'll find another one and bring it to you wherever you are, that's different. If she would have explained something else, but using the words, the way we do things here is we have you come to a doctor's report first. Well, I don't like the way you do things here if you're using terminology like that. So try to stay away from that. If somebody says, I'd like a first adjustment, first thing that I would ask is, if they called and they asked for an adjustment, let's say, the first thing that I would ask is, have you already had your x-rays and nerve scans at another clinic? And they say, no. And you say, okay, well, first you have the x-ray and nerve scan to find out where things need to be adjusted, and then we would perform the adjustment after that, after the doctors had a chance to review the results. That's it. Versus, well, the way we do things here is we take x-rays first, and then we have you come back for a report. Do you see how the verbiage is completely exclusionary? You want the spouse to come to the report. Well, the way we do things here is we always have the spouse come to the report. Versus, very simple, the people who get the best results always bring their spouse to the report. So I want you to do that. As soon as you say the way we do things here, you're opening up in their mind a conversation about where else they could be going. And if they're already thinking about where else they could be going, and they see what you're doing in a negative light, then automatically your follow through is going to have some challenges. So if you find you or your CA is using the verbiage, the way we do things here, versus the way it's done, have a conversation with them about it, clean up that languaging, and don't use verbiage that ostracizes the patient to the other side. You want to be on the proverbial same side of the counter as them, always making sure that your arms around them, doing the best for them, versus your procedures being something that does something to them. Make sense, guys? Hope that was actually our team training for today, so I hope you find that valuable. Thanks.